Hi, Scott Levy, Chief Medical Officer at Doylestown Hospital. We're reaching a point of crossover. More than half the people in this country are in process of getting vaccinated or have been vaccinated. Add that to the 10 to 20% of folks who have antibodies from either having COVID or exposed to COVID. We're really reaching the crossroads where the ability to do activities with relative safety is certainly increasing. Well, what does it mean if you're actually fully vaccinated? Well, as we talked about previously, if you're in a group and everybody's fully vaccinated in a small setting, there's no reason to wear a mask nor socially distance. It's time to think about resuming some normal activities. Even going out to eat in a vaccinated setting is of very, very low risk. There's been a number of people who've been vaccinated who in fact have gotten COVID, probably a variant, or potentially people who are immunocompromised and didn't get a good response. But if you're relatively healthy and you've been vaccinated, you can be very confident that you're not going to get COVID. And even if you're one of those very rare people who do, you could be most extremely confident that your course is going to be very benign, very mild, and life will go on right afterwards. So this is the time to really be very excited about vaccine, and also would encourage those people you know who haven't been vaccinated to do so as well. I just wanted to make a couple of other comments before we close today. I really wanted to thank the entire staff here at Doylestown and this entire community for the support. This week, Doylestown opened our Clark Center for Critical Care, a beautiful facility on the third floor of our critical care suite where our cardiac unit is, 32 ICU beds to help care for people in this community during their time of need. And the staff here in the community support in getting this done has been remarkable. The transition has been fantastic. Friday, it's very likely that the Johnson & Johnson vaccine will be back in the market. If anything, that proves how carefully this has been monitored. Simply 6 cases of a complication was enough to take the drug and freeze it temporarily. If that was done with 6 cases with a new vaccine, imagine how safe the Moderna and Pfizer vaccine are, with over 200 million doses being done, and those drugs are still in the market with no evidence of any safety issues whatsoever. Recent clinical trials have also demonstrated what we've known for some time. If you're pregnant and you're thinking about getting vaccine, the chance of having a bad complication from the disease is much more than the vaccine. And it's a smart move to strongly consider vaccination for the pregnancy status. So think about that as well. We're learning more, doing better. Keep well, keep careful, and begin to enjoy life after getting vaccinated. Have a good day.